As promised, we do have the testimony right now. This is the Senate committee, Appropriations Committee, with Secretary of Health and Human Services, RFK Jr. He is testifying to try to push for his fiscal year 2026 budget. Let's go ahead and listen and hear live now on Live Impact News.
The development of the first overdose naloxone nasal spray, Narcan. For almost a decade, this committee has increased funding towards the goal of finding treatments and a cure for Alzheimer's disease. This goal is very personal to me since both of my parents lived with and eventually succumbed to this horrible disease. These investments have allowed NIH to fund research into a wide variety of potential causes of the disease and build evidence for prevention based on a healthy lifestyle. NIH-funded research of the amyloid protein led to the development of the FDA-approved Alzheimer's drugs in 23 and 24 to slow progression of the disease. All this research is extremely important, and I look forward to working with you to continue to look at diversified Alzheimer's research. Wasteful spending of taxpayers' dollars must end, and I applaud you for taking a hard look at what federal research dollars are funding, and I encourage you to ensure that the fiscal year 2025 funding that Congress has already appropriated is spent in a timely manner, in particular for the vital biomedical research which could lead to life-saving breakthroughs in science. Too many families are waiting for a cure, as you know. We have a responsibility to make sure their taxpayers' dollars fund that research. You and I have talked several times, and I appreciate it so much, about the importance of the NIOSH coal programs in West Virginia and how the work conducted by NIOSH in Morgantown is unique across the federal government. I'm pleased that you brought some of these specialized NIOSH employees back to work earlier this month and then just last week reversed their rifts so that their return to the office will not be temporary. Thank you. Your decision to return NIOSH staff to the office meant that the Firefighter Fatality Investigation and Prevention Program could issue the final report on the December 27th, 2020 fire that killed a 30-year-old firefighter and injured 3 others in West Virginia. Senior Airman Logan Young was one of many who responded to the Carneysville fire. I'm glad NIOSH was able to finish their investigation and issue recommendations and final report. While your action last week was a good step, there are still other divisions within NIOSH with specialized staff who conduct essential, unique work. I support the President's vision to right-size our government, but as you and I have discussed, I don't think eliminating NIOSH programs will accomplish that goal. I encourage you to look at this closely. West Virginia, my own home state, continues to rank above the national average in both new cancer diagnoses and death. We are thankful for the work performed by the CDC National Center for Chronic Disease Prevention and Health Promotion. And I look forward to learning more about how this important work will be continued under the administration of a healthy America. Substance abuse challenges also continue to be a real problem facing West Virginia and the nation. SAMHSA funding has played an important role in West Virginia, and I want to understand how the budget proposal would impact my state. I look forward to learning more about that from you today. I will say there was a bit of good news, I believe last week, when the national statistics of overdose deaths did go down. Rural health care is a top priority for this body. CDC data shows that rural Americans are more likely to suffer from higher rates of diabetes and are more likely to die from cancer, heart disease, and stroke than urban Americans. This is unfortunately true in my state, which also leads the nation in diabetes and heart disease. Improving rural health outcomes goes hand in hand with investing in the healthcare workforce to meet the physical and mental health challenges in America. HRSA has been a trusted federal partner on rural health issues for decades. HRSA has funded critical rural health capacity building and other initiatives across the country and administers the healthcare workforce programs that help bring medical providers into local communities. You have proposed moving HRSA into the new AHA, and is that how I say it? AHA. I would like to learn more about how your budget proposal would invest in rural America. We have a difficult task ahead of us, but it's my hope we can and will come together, just as we have done in prior fiscal years, to use our limited resources in the most efficient and effective way. So, Secretary Kennedy, I look forward to your testimony, and I now will yield to my, or not yield, but turn the microphone over to Senator Baldwin.
Thank you, Chair Capito, and I too look forward to continuing our strong bipartisan work together. Secretary Kennedy, today we are here to talk about your fiscal year 2026 budget request to Congress. You run a department dedicated to improving the health and well-being of every American. And these programs that you are responsible for administering touch the lives of all Americans at a critical moment in their lives, from research for life-saving cures and treatments for devastating diseases, to maternal health care, to child care, to addressing substance use and mental health. You have repeatedly pledged that you would run the department with, I quote, radical transparency. While this is a great catchphrase, it could not be further from the reality that we're experiencing right now, as we talked about yesterday. As required by law, a few weeks ago, the department sent this committee a plan for how it will be spending appropriated funds this year under the CR. But instead of providing Congress and the American people with any information about how the department is spending tens of billions of taxpayer dollars, there are only asterisks in place of spending levels for over 530 programs. In no other job under the sun can you essentially leave blank how you are spending billions of dollars. This is flatly unacceptable when we are talking about taxpayer dollars, and the people I represent deserve better. You are undertaking a massive and disruptive overhaul of the department. You are shutting entire offices down and firing thousands of experts. Your plan for all of this that you provided to Congress is little more than 1 page long. And that shows the chaos that this is creating. I'm assuming today you're going to reiterate talking points about how you are consolidating offices and eliminating duplicative functions. But Secretary Kennedy, this is a genuine request. Please sit down and talk to us in detail about what you are doing. Have your staff talk with our staff on both sides of the political aisle about your plans for the department and what you are doing right now. For a department this important, anything less is simply not acceptable. Let me turn to what it is that we do know about your budget request and what is happening at the Department of Health and Human Services. Your fiscal year 2026 budget requests cuts to the National Institutes of Health of $18 billion. That would have a devastating impact on research into life-saving cures and treatments for devastating diseases, setting back medical innovations by decades. It would push the brightest scientific minds to work in other countries. It would cede our leadership in biomedical research to China. It would also take away hope from millions of American families. For the family receiving a devastating diagnosis of pediatric cancer, like Charlie and her mom, Emily, who spoke to this committee last month, it would mean less hope. For Jesse, a veteran and a father with ALS, and his son, Dewey, who wants his dad to see him graduate from high school, it would mean less hope and less time. This budget says a lot about the priorities of this administration. And normally I could, I guess, disregard it as only a request. But it provides insight into what you're doing right now in fiscal year 2025. At the same time you are submitting this request, you are actively stopping billions of dollars in NIH funding for life-saving research, including on cancer and Alzheimer's disease. You are implementing changes right now that are ripping away hope and life-saving cures from American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate offices is endangering children, including thousands of children in Milwaukee. If you have a proposal to make these programs work better, present it and justify it. Mr. Secretary, you will say that you have to fire thousands of employees and eliminate programs like LIHEAP because our deficit is too large. But you won't mention that at the same time this administration is proposing these cuts, it's proposing tax cuts for billionaires that will add trillions to our debt. You are cutting programs and firing staff with no plan and no understanding of what the department you are leading even does for the American people. And that's why you had to rehire staff working on the World Trade Center health program and screening coal miners for black lung disease. You fired everyone, and now you want to take credit for hiring them back? That's not how this works. Congress provided over $360 million on a bipartisan basis for NIOSH. You eliminated the entire Safe to Sleep program that the Eunice Kennedy Shriver Institute. Safe to Sleep is one of the most successful child safety campaigns in history that prevents 1,500 babies from dying each year, at a time when we are seeing rates of SIDS starting to climb. Without staff, these programs are meaningless, and this is happening across HHS. I could go on and on about how this administration's careless and reckless approach is hurting the people of Wisconsin and this country. These are just a few examples. Mr. Secretary, this committee has worked in a bipartisan manner to improve child care options for working families, address the substance use disorder crisis, support seniors and people with disabilities so that they can live in their communities, and to make the United States the leader in biomedical innovation. You're implementing changes right now that are dismantling our progress, and you're hiding it from Congress and the American people. We don't need to just reject this budget request. We need to reject what's happening at HHS right now. We need to do that before you have caused irreparable harm at the department and the programs it administers that millions of Americans rely on. I yield back.
Thank you. Secretary Kennedy, we welcome your opening statement.
Is it on now? All right, thanks. Thank you, Chairwoman Capito, and thank you, Ranking Member Senator Baldwin, and all the members of this committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, we aim to make America healthy again with a special focus on chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs for taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developing nation, despite the fact that we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong. All the money that we've been pouring into these programs for years has not resulted in better health for Americans. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, veterans, American Indians deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary health care physicians. We will prioritize these families, especially the Native American and Alaskan communities. Protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulation, inspection, and education to remove harmful chemicals from food and packaging. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs, as we did last week when we approved South Carolina's application for support for a program, the first program in the country that provides cell therapy and gene therapy to every person in South Carolina who has sickle cell anemia. For fifth, we will eliminate DEI funding and redirect. Sixth, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we will be the cutting-edge agency using this technology to manage healthcare data more efficiently and securely, and to give Americans control over their own health. Finally, we will rebuild public trust that eroded through years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency in public service, creating an honest, science-driven HHS that answers to the President, to Congress, and the American people. And I just want to say, salute the people wearing purple in this room, I assume as an emblem of their commitment to solving the Alzheimer's crisis. And Alzheimer's is a very, very good example of how NIH has gone off the rail over the past 20 years with research on amyloid plaques and cutting off any other hypothesis because of corruption within the agency. And that has derailed Alzheimer's research in this country for 20 years, and I'm committed to solving the problems of Alzheimer's, also understanding why we're having an epidemic of Alzheimer's, why it is increasing. And I have Alzheimer's in my family, and many members of my family are activists in this community, and I have a deep personal commitment to solving this issue. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again.
Thank you, Mr. Secretary. And I am going to turn to the chair of the full committee, who we're honored to have here, as always, Senator Susan Collins, for 7 minutes for questioning.
Thank you. Thank you very much, Madam Chair. And I thank the Vice Chair as well. Welcome, Secretary Kennedy. Secretary Kennedy, the military services submit to Congress what is known as an unfunded priorities list. It includes funding requests that were not included in the President's budget, but oftentimes we take from that list and do fund what the military was unable to get into the President's budget. And just to give you some idea, the unfunded priorities lists range from more battleships to better housing for our troops to weapons R&D. It really covers the map. Your department's budget has been sharply cut by 26% below the fiscal year 2025 level. If you were required, as our military services are, to submit an unfunded priorities list, what would you include on it?
That's a good question, Senator. I would include the research that has been neglected for the past 20 years on chronic disease and what's caused us to go from 3% of Americans of children having chronic disease when I was a little boy and my uncle was president to 60% today. I would want to look at the thousands, over 10,000 chemicals that are now in our food. Most of them have never been tested. I'd want to look at what's causing the infertility crisis. Why are girls in this country reaching puberty 6 years early? They're earlier than historically. Why do boys in this country have half the testosterone teenagers of a 68-year-old man, half the sperm count of a 60-year-old man? I would want to do research on why our bees are disappearing, why 90% hive collapse happened, which is a food issue. I would want to look at the microbiomes in the soil and how that's contributing to erosion and how the chemicals that we're using in agriculture are sickening farmers in many cases, potentially, and are destroying the microbiome and creating a situation where soil is running off and where most agronomists believe that we only have 60 harvests left. And I would want to look at why we're having an explosion in Alzheimer's in this country, not just curing it, but what is causing it. And I think NIH has done a very good job at making cancer more survivable. For example, colorectal cancer, where there's been extraordinary science done at NIH. Why isn't NIH asking the question, why do we have colorectal cancer in children? This is something that's new to humanity. And it was never known before. And now it's an epidemic in our children, and we need to have a balance where we're looking at cures for diseases, but we're also focusing on how to keep Americans healthy so that we can beat these ruinous healthcare costs and that we can have a healthy, productive society.
Thank you. I want to turn to a couple of other issues. First of all, the LIHEAP program, which we've talked about, is absolutely vital for thousands of older Mainers and low-income families. It helps them avoid the constant worry of having to choose between keeping warm, buying essential foods and medications and other basic necessities. Now, I was pleased to see the release of the rest of the fiscal year 2025 funds, but the administration's new budget seeks to eliminate what is truly a critical program. Will you work with this committee in trying to restore the LIHEAP program so that we can avoid literally seniors and low-income families not being able to keep warm in the winter?
Yeah, absolutely. And I'm from New England. Myself, my brother, for 40 years has run a Citizens Energy, which provides low-cost home heating oil to families in New England. And so many people have come to me over the years and said to me, thank you, your brother saved my life, because I didn't have to choose between food and heat. I was on the Navajo reservation 3 weeks ago, and Navajo President Boo Nygren said to me, if we cut LIHEAP, Navajo will die from it. So I understand the critical historical importance of this program. President Trump's rationale and OMB's rationale is that President Trump's energy policies are going to lower the cost of energy so this program, so that everybody will get lower cost heating oil. And in that case, this program would simply be another subsidy to the fossil fuel industry. If that doesn't happen, then I would, and Congress chooses to appropriate the money, I, of course, will spend it. I've already directed the spending of $400 million in this year's budget to that, and I will work with you to make sure that those families do not suffer in that way.
Thank you. You and I've had many conversations about Alzheimer's disease and the BOLD Act. I do want to point out the CDC's cooperative agreements for the Healthy Brain Initiative and 3 dementia public health centers of excellence under the BOLD Act are set to expire at the end of September. We initially expected that the CDC would put out a notice encouraging applications early this year. Inexplicably, no such notice has been issued, even though we reauthorized the BOLD Act and funding is available under the appropriations measure that President Trump signed into law in March. How and when does HHS plan to issue this notice of funding opportunity so that we can continue what has been a very effective approach to the Healthy Brain Initiative and Centers of Excellence? It helps caregivers. It encourages early diagnosis. It really has been an important program, taking the kind of public health approach that you've generally supported.
Yeah, Senator, because of the TRO from the federal judge on this issue that was issued last week, I've been instructed by HHS and by White House attorneys that I can't speak directly to that part of the reorg. I have a strong personal commitment to, as I said before, to Alzheimer's, to dementia, and it's affected members of my family, and I understand how important these programs have been. And whatever happens, we will continue that research.
Senator Baldwin.
Thank you, Chair Capito. Secretary Kennedy, very quickly, when I ask you for information or my staff asks your staff for information, do you commit to responding?
Yes, Senator, of course.
And when might I expect a detailed operational plan? I've referenced in my opening statement the fact that 530 programs or activities, when you provided that information, had an asterisk in place of a dollar amount. When might I expect the detailed plan? When?
As I explained to you, those decisions are being made by OMB. And
So you're really not in charge of the spend plan for...
This is not a HHS issue. It's a government-wide issue.
Okay, so the Secretary of
and it's not on-
HHS is not in charge of the spend plan for 2025. I'm going to move on. Research funded by the National Institutes of Health has pioneered the development of new technologies and cutting-edge treatments, including immunotherapies that are saving lives and giving millions of Americans suffering from devastating diseases more hope and more time with their families. Last week, American doctors made history with the world's first successful personalized gene editing treatment in a 9.5-month-old baby boy, curing him of a rare, life-threatening genetic disorder. This technology is miraculous, and it was made possible by NIH research. According to the American Cancer Society, NIH-funded cancer research saved 3.5 million lives between 1991 and 2019 and reduced the overall cancer death rate by 33%. Congress has spent nearly 100 years building up the world's premier biomedical research agency to develop state-of-the-art treatments that wouldn't have been thinkable just decades ago. And in just 100 days, this administration is starting to tear it all down. NIH has awarded nearly $3 billion less in funding. So the graph on on my right, $3 billion less in funding compared to the same period last year. That's more than 3,200 fewer grants. These grants are being withheld. This includes funding for everything from cancer to Alzheimer's disease to rare disease research. Secretary Kennedy, whose decision is it to withhold thousands of grants and billions in funding for life-saving medical research at NIH?
I can tell you, Senator Baldwin, that gene therapy and cell therapy is a priority for me and for Marty McCary, who's the FDA director. We are going to ensure that this country remains the hub of gene therapy.
That wasn't my question. Secretary Kennedy, whose decision is it to withhold thousands of grants and billions in funding for life-saving medical research at NIH that we approved on a bipartisan basis in this subcommittee?
We are not abandoning any life-saving research at
Is it
NIH.
DOGE reviewing NIH funding opportunity announcements? Is it DOGE reviewing NIH grant award?
We've got administrators, we're cutting waste, we're cutting duplicative programs.
And you're funding $3 billion less in biomedical research than you did a year prior.
We're spending less on administration of those programs.
3,200 fewer grants.
We're spending, well, many of the grants were terminated because they were grants that were not advancing.
These aren't grants terminated. These are grants not awarded because the panels weren't convened.
We spend 70% of the world's biomedical research out of NIH, 70%, and we're the sickest country in the world.
$18 billion or 40% from the NIH budget slow the development of new treatments and cures?
And we are the sickest country in the world, so that money has not been well spent. We've had a 38% increase in our agency, growth in our agency over the past 4 years.
I'll ask you, is funding for Alzheimer's disease research centers DEI? because you're holding up $65 million for 14 of those centers in 9 states, including the University of Wisconsin-Madison. Is funding for cancer centers DEI? Because you're holding up $47 million in cancer center support grants at 9 cancer centers in 8 states. Is funding for rare disease research DEI? Because you're holding up $55 million for 11 rare disease clinical research network grants in 8 states. These are just a few examples, and the list goes on and on, Secretary Kennedy. I've run out of time. I yield back.
Thank you.
This is a fun game we're playing.
Mr. Secretary, let's talk about
Answer
clinical trials.
questions and to ask questions and don't give me a chance to answer them. Don't give me time to answer them.
Well, maybe in some of my questions, you can elaborate on some of that. I want to ask you about the clinical trials, because she does have that up on her poster there. Clinical trials are the forefront of research, innovation, and oftentimes represent that last hope for cancer patients and other patients addressing chronic disease when traditional treatments have been effective. These clinical trials are often lead to getting life-saving drugs to the market. Has HHS or any sub-agency assessed the impact of patient access to clinical trials through the reorganization effort?
We are not cutting any clinical trials. We're not cutting any clinical trials. We're not cutting drug development.
Thank you.
Cutting administrative costs.
A question on indirect costs, because, you know, this is a biggie. When it was announced that that NIH announced it would cap indirect costs at 15% for research. We talked about this actually in our meeting. We talked about the possible adverse effects of this. And like I've heard from West Virginia University, Marshall University, which receive smaller amounts, but I've heard from everybody across the country in terms of the research. West Virginia University is a member of the Association of Public and Land-Grant Universities, and they are working along with schools and independent research organizations across the country to come up with a new model for indirect costs. Are you aware of this effort, and have you met with them to discuss their work?
I haven't met with them, but we are talking with lots of people about a new way to fund indirect
Are you aware
costs.
of the effort that's going on with a whole bunch of stakeholders that are trying to figure out a way to do this better?
Yes, we are. And Jay Bhattacharya is very interested in this. And as you know, Senator, there were some of the private universities that were abusing that. We had Stanford, which has tens of billions of dollar endowment that was using our money. We wasted $9 billion last year of NIH's budget on indirect costs. We're paying some of these universities up to 78%. That money was not going to research, not all of it. In the public universities, we are very much aware that those universities are using the money well, that it is absolutely necessary for them. And we're looking at a series of different ways that we can fund those costs through them, but not through the independent indirect cost structure, which loses all control, which deprives us of all control of how that money is spent.
Well, in my many conversations with a lot of the research, because I don't think anybody here wants to lose our valuable research, and I put you in that bucket as well. I do know there's a recognition that there's not enough transparency, that the system needs to change, and so this group that's being put together, I think, is very thoughtful in their approach, and I would encourage you, as you've already done, with the head of NIH.
Yeah, and I'm happy, Senator Capito, I could talk to you right now in detail about some of the alternatives that we are considering.
Okay.
But we are taking it seriously, and we understand. But, you know, in Maine, at the University of Maine, the University of Alabama, many of these other state schools badly need this research. They're doing cutting-edge research, and they need that money that was going through indirect costs, but we think there's a better way to pay that out.
Okay. Well, we want to work with you on that. Let me talk about rural health. I mentioned it in my opening statement. I know you've been to our state, so you understand the rural nature of many of our states. You know, there's such significant healthcare challenges in rural America, a lot of it around access. The rates of chronic conditions like diabetes and heart disease are among the highest in the country in rural America. HRSA programs are critical to rural health and initiatives, and you've in your budget, announced a cut to HRSA programs. I am concerned about that because of the access issue and because of the inequities that I think I see, and I think we see sometimes between where people have easier access to health care than in rural America. You got transportation issues, you have connectivity issues, you have just generational issues of passing down different diseases. How is rural America going to be better under your new reorganization?
You know, there's a lot of ways, as you point out, under HRSA, and this is a priority for me. It's one of the commitments I made. When I was doing my Senate confirmation, it was the issue that was most often raised by the various senators who I talked to. These facilities, we're seeing an epidemic of closures in rural hospitals, rural areas around the country, and these not only provide critical access to care. If you don't have that hospital, people may have to drive 2 or 3 hours to get to a site, and that means people will die. They also are critical to the economy and the culture of rural America. They provide jobs and high-paying jobs, and they're economic drivers for those communities. So we're determined to keep them open and to do everything that we can to help them. And we're doing that through a combination of different ways under HRSA, through the community health centers, the National Health Service Corps, which provides badly needed personnel, which is a huge deficit in rural areas. The GME program, which does education for those through rural health, but also through innovations like to provide better health care through telehealth and through AI and through wearables and apps that can actually save people hospital trips. I spent 2 hours yesterday meeting with the CEOs of some of the biggest and most effective health tech companies in the country, and the potential that we have to transform rural health care. For me, I walked out of that meeting very, very optimistic and very excited about the capacity that we now have through technology and AI to transform, to save, to rescue rural health care around this country.
Thank you very much. Senator Durbin.
Thank you for being here, Mr. Secretary. Let me ask you a startup question. Do you know the #1 cause of preventable death in America today?
The #1 cause? Well, I know what the #1 cause of deaths is in this country. I'm not sure what you're talking about.
I'm talking about tobacco. You fired the head of the CDC's Office of Smoking and Health and eliminated their efforts from your budget. Hundreds of employees at FDA's Tobacco Center, including the director, have been let go. If we are genuinely concerned, and I believe you are, about the health of America and making it better, something as basic as the #1 preventable cause of death is not served by that kind of dismissal. Let me take you to another issue that I think is personal to me in a way. It reflects a tragic situation involving ALS. A friend of mine named Brian Wallach used to work in the Obama White House, and Brian met his wife-to-be, Sandra Abravaya, who was my press secretary. They married. When their second daughter was born, Sandra came home from the hospital to learn that her husband had ALS. Brian and Sandra have been fighting a battle now for 8 years. He's still alive. He can no longer walk or talk, but he has hope. He loves his family, and he's hoping that something will break through in ALS that gives him a chance for a future. Please explain to Brian and Sandra and their 2 young daughters why you've canceled ALS grants at institutions across this country and why you think research for diseases like ALS should be cut by 40% next year.
Senator, I don't know about those cuts. I will have to, I don't know if that's true. I don't know if those were part of the rifts, in which case the people were not fired, but they were put on administrative leave. The issues that you're talking about are issues that are important to me: tobacco, ALS, and I know you have a passion for congenital heart disease as well. Those are all issues that I'm deeply concerned with, and I'm happy to meet with you at any time and talk about the programs and what we can do to make them better.
Of course, you're welcome, and I think the conversation is important. But I want to remind you, on April 1st, 10 laboratory heads at National Institute of Neurological Disorders and Strokes received their layoff notices. They were all PhDs and senior investigators. They're not administrators, whatever that might be. They were running intramural labs at NIH. If you have your way, they'll all be gone on June 2nd. Science magazine reported 25 of 320 physician researchers at NIH's Internal Clinical Center are leaving, and the number of patients treated in the hospital has been reduced by 30%. 3 grants involving ALS and dementia work at Northwestern University in Illinois have been paused. One looking at how to stop the buildup of damaged proteins, another looking at cellular mechanisms that can be drug targets. Just last week, an ALS researcher at Harvard had his grant cut that was using AI to accelerate the reversal of ALS symptoms. Brian Wallach is waiting for a cure. He is not giving up. His source of hope is this research that you unfortunately are terminating. How can we possibly address his concerns and give hope to people across the country who are suffering for so many diseases when our government is cutting back on that research?
As I said, Senator, I do not know about any cuts to ALS research, and I'm happy to meet with you.
I just read them to you.
Yeah, I will have to go and talk with Jay Bhattacharya and find out what the rationale was for those cuts. I just don't know about them until you told me about them at this moment.
There are many things that concern both of us about the state of public health in America. And questions you've raised, I think, are legitimate questions, many of them, that I want to follow through. I want to know the honest scientific answer to these questions. And I want to make this point. Cutting medical research is giving up on the future. You can't do that. These families are counting on you, Secretary, and counting on your department to do this research. It gives them hope to live another day. Turning out the lights and saying you're doing it in the name of efficiency or DOGE or whatever it is no consolation to these families that are struggling. Thank you, Madam Chair.
Senator Moran.
Thank you, Chairman. Secretary, welcome. Kansas, my home state, is one of several states that are facing the impact of a recent measles outbreak. We had 56 cases confirmed measles, with 54 cases being in a southwest part of our state. Among the 54 outbreaks, 48 of those patients were unvaccinated or had unknown vaccination status. Overall, the state's cases, 45 of those patients or victims of measles were children. What do you need? What do you need from us? And what can you do currently to be of help to the Kansas Department of Health and Environment in support of their response to ensure that this outbreak doesn't spread and to make sure that those who have been positive for measles are cared for and this becomes a thing of the past, not a thing of the future?
Yes, Senator, the best way to prevent the spread of measles is through vaccination. We urge people to get their MMR vaccines. There are groups in this country that don't want to be vaccinated for many of them for religious reasons. I've spent a lot of time with the Mennonites, and the MMR vaccine has millions of fragments of human DNA in it from aborted fetal tissues, and that's a religious objection for them that I have to respect. We need to be able to treat people who do get sick, which the CDC does not give people advice, physicians advice on now until I came in and we started a new program to treat people who actually get sick. We've done a better job at controlling measles since I came into this agency than any other country in the world. Today we're at 1,035 cases, and we only added 27 cases last week. Canada, which is 1/8 of our population, has an outbreak double that size, and they added 300 last week. Mexico, which has a population 1/3 our size, has almost the exact number of measles that we do. Europe has almost 7,000 cases, so 7 times what we have.